Hello, everyone. Thanks so much for joining us for Careers in Healthcare. My name is Stacy Owen, and I'm the Executive Director of Alumni Engagement for the School of Business, but sit on the career team at the School of Business. We're really excited to have you here. We have different audiences. We have current students at the university and at the business school. We have students in our MBA program. We have students in our pre-experienced master's programs. And we also have alumni on the call. We made this open to anyone as a way to learn more about healthcare, hearing from some of our alums who have worked in healthcare about their jobs, their journeys, and then we will take any questions that you may have. I am recording this session, and I'm sure we will make the link available to anyone who would like to watch this again. So let's first start with introductions. Matt, you're first on my screen. If you could, if everyone could say their name, where you work, what your title is, what program you graduated from, and where you're currently based, that would be great.
Okay. Matt Nickerson. I'm a MBA grad from a full-time MBA in 15. In Raleigh now, and I work with PricewaterhouseCoopers, PwC, in their consulting practice, and currently a senior manager with them.
Perfect. Nancy?
I'm Nancy Brownlow. I'm actually a double deek, so I went to undergrad, got a degree in political science, and then graduated from the full-time MBA program. I am currently the Director of Financial Planning and Analytics for the University of Tennessee Medical Center in Knoxville, Tennessee.
Great. John?
Hey, folks. Good evening. My name's John Wright. I went to undergrad for Wake. Had enough, so I got my MBA someplace else. Not a glutton for punishment like Nancy is. But I am at Wake Forest Baptist, which is now part of Atrium, which is now part of Advocate. So I'm a associate vice president of performance excellence here.
Thanks to all three of you so much. I know you've been at work all day, and for making yourself available to our students and alums. We really appreciate it. So thank you. We do have a fourth panelist who may join us late, Logan Ware, and we will introduce him when he joins the call. So we have three primary questions for our panelists, and it's tell us about your journey into healthcare. What is your job like? What kind of things do you do? And any advice that you may have for those who want to transition into this space. And we'll focus on one question at a time. Nancy, I'm going to let you start with sharing your journey into healthcare and how you ended up working at the UT Medical Center.
Sure. So I was a career switcher. So I had a degree in politics and journalism out of undergrad, was working for an advertising agency, and kind of figured out that that's not what I wanted for the rest of my career. So that's what prompted me, honestly, to go back and get my MBA. And I wanted a career where I knew I was doing something that was contributing to my community. And so to me, a healthcare was a natural course to get there. So I focused on healthcare. I think my concentration was healthcare management and ops in the MBA program, and was kind of intent on getting a job in the healthcare space once I graduated from the MBA program. So I did. I started actually at what is now, John, I think you said all the things. So I started at Carolinas Healthcare, which was then now Atrium, Advocate, all the things. So started down in Charlotte there, worked with, got great exposure working with the regional hospitals. So one's not based in Charlotte. And then my husband and I moved to Knoxville 12 years ago. And so was in the healthcare space in Knoxville, kind of interviewed around. There's a couple of different healthcare systems around here. Spent a good bit of time, 10 years at Covenant Health, which is a big nonprofit here. And then recently moved to UT Medical Center.
Great, thanks. John, how about you? You've been at Atrium for a long time.
Yeah, I have. Before that, I mean, so healthcare is my fifth industry that I've been in. So I found a home here, and for much the same reason I decided to stay is what Nancy said, which is it's a little more meaningful. But and I've been in third-party logistics, software development, higher education. I worked at the university there after I graduated for some time, and in the military. So I think through all that. Um, Always having an eye toward opportunity was kind of what I think would be the theme of my career. Looking always being someone that questioned. I think it comes from the philosophy background, and always having an eye for where are the opportunities in current operations. And so I quickly got into IT service management, Lean Six Sigma, got certification that I got my project management professional. So really I'm a project manager by trade, and that's what took me through a few of those industries. Landed here in 2015, and to help this organization execute on a rather aggressive strategic plan. As Nancy mentioned, the merger and acquisition activity is significant in multiple industries and certainly in healthcare. And so at the time, this organization wanted to double in size in only a few years, and so they needed individuals with skill sets for managing that rapid change. And then so I stayed in that role, an enterprise project management role. Then I ended up moving into a leadership role in the revenue cycle. So there were a lot of that function is really accounts receivable on steroids, and in healthcare, there's been a lot of regulatory pressures, a lot of external factors that have made the revenue cycle more difficult, and so leveraging technology to become more efficient and effective at the same time. So that's how I ended up landing in the revenue cycle. There were a lot of consultants that had come and gone. Consultants are fantastic, but there can be a lot of fatigue that comes from internal team members. And so join the organization and help them focus on year-over-year cash yield improvement, thinking about how can we be more efficient and effective in our revenue cycle processes. And did that for 6, almost 7 years.
Great, thank you. All right, Matt, let's talk
Okay.
about healthcare and consulting and PwC.
Yeah, the journey of this, it's kind of funny listening to John's story. I'm a little bit of the inverse. Everything I've done's always been kind of centered around healthcare. It's just been how I fit into that realm. So I was actually a senior in college as an athletic trainer, pre-physical therapy when 9/11 happened. Um, Enlisted in the military as a medic, served 9 years roughly. Got out and was going to finish up my undergrad actually as pre-med, public health pre-med. And as it happens throughout my story, things kind of just change and shift. And Stacy knows that when I started my MBA program, my son was very, very young, and my wife was pregnant with our second one. So realizing I was like 32 and how long med school was, that kind of caused a shift in what I wanted to do. So ended up pursuing, I was like, well, let me go on the business side of healthcare and pursued my MBA. While I was doing the MBA, everything was kind of centered around operations. So Six Sigma Black Belt while I was there, and PMP, CPHQ, did all those things. Oh, well, CPHQ came up later. That's healthcare quality. In the internship, I just happened to have an internship, got in with PwC, thought I'd be doing operational type of stuff, operational improvement in hospitals, and just, life happens while you're trying to do something. And some people pulled me into this department called strategic reimbursement. So working around not accounts receivable, pretty much anything kind of higher level than that with CMS reimbursement, a lot of things I probably don't need to get into, but pretty much strategies and working with a bunch of CPAs essentially to figure out different strategies for reimbursement, Medicare, Medicaid, reclassifications, DISH, a lot of different programs around that. So kind of reinvented how we did a lot of things. And then learning new things as I went. So geospatial analytics, a big part of what we do now. Had no idea how to do that, just learned how to do it on the fly. A lot of, right now we're working with like Databricks, some data lake type of stuff, some big data, you applications. And so, yeah, it's just been all around healthcare, but exactly what I've done within healthcare has just constantly evolved and changed. And yeah.
Well, I think in listening to the three of you, and I think it's such a good message to share with our audience, because not one of you had the same path. Not one of you has the same background. John, you've referenced that healthcare has been your fifth industry. Some of you are, two of you have a military background. You talk about operations. Nancy, you wanted to have a role, to be involved in an industry that was helping others. So I think it's clear that you don't have to fit into a specific mold, and there are lots of different things that you can do within the healthcare industry. Let's talk next about each of your specific firms. So it's a two-part question. It's what's it like to work where you work, and can you give us an example or two of the type of project that you're working on to further share what a day is like for you and the kind of work that you do. And John, we're going to let you go first this time. So a little bit about your work environment and then some things that you work on.
Boy, that work environment's changed a lot in the last 4 years. I'm actually in the office, but most days I work from home. In this building, we had, 4-story building over here behind Haynes Mall in Winston-Salem, was where most of our revenue cycle was. 2 parking lots full every day of staff coming in and out. Very transactional, a lot of transactional work in the revenue cycle. So staff that are churning through, encounter after encounter, account after account, getting authorizations or working down, getting bills out the door, coding things. Very, very, very transactional environment. So you see a lot of spaces, no clinics in this building. And then COVID hit, and almost overnight, those parking lots got empty. We had to figure out how to transition people home. And ever since then, it's been very different. And I think that's one of the things that has helped out with the administrative side of healthcare is there has been a lot of these roles could have been work from home for years, could have been remote for years, and this really accelerates in that environment, which actually really helped out expanding our talent pool for hiring of staff. Now we're mostly remote. I'll say that has come with its own struggles. There's a lot of values when you're talking about driving improvement, understanding operations. Relations are so important. I don't think it mattered. Nancy mentioned that earlier, but the relationships are so important, and so that has become more difficult to just have those offline conversations with individuals, know about their life, have those personal connections that then you go to draw on whenever you need to make a change and or need support for something. So I think that's the environment. I would say in the role that I'm in, a lot of meetings by now. I think some of my team members actually came out of some of the programs at Wake. One of my best team members came out of the Masters in Business Analytics program from Wake. Exceptional individual, and try to protect those individuals from as many meetings as I could. And then lastly, I would say a couple of examples would be so I mentioned regulatory earlier. So we impact the patients. This function impacts the patient experience a lot more, as regulations have changed. And one of them is estimating a patient's out-of-pocket responsibility. It's now a regulatory requirement to provide those level of estimates. So one of the biggest things that we've had to work on is how do you manage that patient conversation, give them that estimate up front, explain all the complexities of healthcare billing. How their insurance provides, understanding, what they can do. So that working through that good faith estimate process has been one of the exciting opportunities. And then the other side would be, working to find patients financial assistance. So patients who don't have coverage, and seeing that the level of impact that we can have on their life by getting them approved for Medicaid, or working through a pharmaceutical copay program, or even at the end of the day, getting them on charity, and relieving that burden, that financial burden, off of them, is there's a lot of satisfaction, in being able to help with the patient's financial health as they're going through. That's really the least of their priority, but at least taking that burden off of them is very fulfilling.
John, I'm going to ask a follow-up question. You referenced the number of meetings that you have. Has that changed since COVID? Is it a result of not having the same the people at work, next door to you, where you could have hallway conversations? Have they been replaced with meetings, or is it just the way your environment has changed in general?
Yeah, there's some good white paper topics there, or organizational development, and I think you could right. But I would say it's actually gone up, and as a leader, I think it's gone up, because before I could walk right down the hall. I could walk down the hall. I could talk with individuals. I would block out time to go walk around and just around with the team. Now you have to be very intentional about that, and so I as well, so it's more one-on-ones, not only with my team, but my counterparts, or even external stakeholders that I need to maintain relationships with, maybe in compliance, maybe in clinical operations, et cetera. So you have to be very intentional, about creating. So a strategy I've employed, and whether it's the right one or not, is actually creating, monthly, quarterly, weekly one-on-ones where there's just a touch point with those individuals. And so that has added, I would say, more meetings, and then having to get team members together to talk about different topics. Yeah, I think overall it's added to the meeting on the calendar.
Okay. Great. Thank you. All right, Matt, talk to us about PwC. What's your work environment like, and what are some of the things that you're working on?
Yeah, so PwC, large accounting firm with assurance and tax, and then also the consulting side. Or advisory, they call it. I don't know. We shift every couple of years, and I've been here long enough. I stopped paying attention to exactly what we call the different parts. Just part of being part of a bigger organization. It's hard to describe exactly what I do. I kind of call myself a free range consultant, because I kind of take the bits and pieces of what we do and look for new opportunities. So different ways to engage our clients and provide something of value to them, or different ways to approach problems. So right now I've probably got 6 or 7 different initiatives going on. Some of them, around more kind of accountancy, as I say. Accounting was like always my worst subject. And now I'm stuck in the middle of a bunch of accountants, which is interesting. But there's different things we're doing around technology, bringing in the ability to increase the velocity and accuracy of analytics. And we work nationally, so across the entire United States. So like when I do an analysis of like geographic optimization, it's of all 3,200 hospitals in the US, acute care hospitals. Have different clients throughout the US, and get to travel. Some can be good, can be bad, depends what's going on at home and what the kids are doing and stuff like that. But there are advantages to it, and it's nice to see a lot of different things. Probably my biggest thing I'm most excited about right now, we just started a new service offering that's very consultancy, right? But working with hospitals to convert RHCs, so rural health clinics. There's a lot of push around rural health equity. And originally I'm from rural Appalachia, so it's kind of near and dear to me personally. Being able to improve the reimbursement rate for Medicaid patients at these rural health clinics. It's one of those things where a lot of things we do, at least, in the strategic reimbursement route, is budget neutral, at least, as per either a state or nationally. But in this case, there's, real impact that can be driven with access for underrepresented or underserved areas. So, taking our geospatial analytics, finding out where in need populations are, where those clinics are located, going back to kind of my working in a clinic, being a medical personnel, going through the clinics and helping them get ready for audit. So they have to be certified, accredited. That's kind of neat for me, get behind the computer and actually get out and talk with nurses and doctors, which is nice. And it takes me to some very remote places, which I think is interesting. Not the big cities we're used to, working with like big AMCs and whatnot. And yeah, it's just a really neat initiative. There's a lot of leeway in what I do for what I pursue, which it can be bad because, if you don't produce in the world I live in, you're kind of, well, you're out of luck, you're out of a job. But on the other hand, if you do, it can be very rewarding as well. So
Have you seen a difference in your work environment since COVID and after COVID? Or has it been the same given the nature of your work?
luckily not. I mean, this is my home office. We have an office in Raleigh. I've been there a dozen times, maybe in 9 years. Usually travel to different offices. So other than not traveling for a couple of years with COVID, it's kind of remained largely the same for me. So.
Great. All right, Nancy, how about you? What's your work environment like, and what are some things you're working on?
Yeah, so my work environment probably sounds, just listening to the other two, Matt and John, talk about theirs, I feel like mine sounds much more traditional finance. We're in the middle of budget, and I am eating, breathing, living budget right now, trying to get it balanced and wrapped up in the next couple of weeks. So it's a heavy budget season. But that's probably not all I do. I was thinking just kind of today, I had a call about Lead the Stay, a lot of kind of strategic finance initiatives. We do all the pro formas for the organization. So we have several rural health clinics, like what Matt was talking about. So we're working through the financials of those and seeing what makes sense in our community. We also are doing evaluation of those performas as time goes on and we open them and, business starts in those areas. And then a lot of profitability analysis and strategic finance initiatives. A big thing for us is we are a 340B facility in a state that has not expanded Medicaid. And disenrollment of Medicaid post the pandemic started really in earnest in April. So it's been something we've been watching very closely because it certainly changes the finances of our organization. And we heavily depend on that money for a level 1 trauma center with a 67-bed NICU, making sure we have the services that we need for the community and the patients that we take care of. So it's a very much like there are, I will say, a lot of meetings. We are organized kind of as service lines, but we call them centers of excellence. So we're constantly meeting with the directors of those centers of excellence, discussing financial performance. And we are also probably in office more, I guess, than I hear in some of my colleagues across the country. I think part of that is just where we are in the country. We're in Tennessee, so yeah.
Great, thank you. All right, last question. Do you have any advice for young professionals who want to get their foot in the door, either at your firm or in the healthcare industry? Now that you're on the other side, any words of wisdom that you can share? And let's see, Nancy, we're going to let you go first this time.
So I guess I would probably say two things. One is to kind of say yes. The job that I took at Carolinas when I started right out of MBA school was not the job I dreamed I was going to have coming straight out of MBA school, but it's taught me so much so quickly. and really has helped shape my career because I learned things there that I'm still using many, many years later. The other thing I would say is just start networking and interviewing with people. When I moved to Tennessee, we moved to Tennessee for my husband's job, and I did not have a job, and I wanted to stay in healthcare, and I was really passionate about that, but there weren't a lot of jobs in healthcare in Knoxville, Tennessee. So I interviewed at UT Medical Center where I am now. I interviewed at Covenant Health where I spent 10 years. And then there's a third big player here, Tenova, which is for profit. It's part of the HCA system, or HCHS now system. And I interviewed at all three places, not necessarily that they had a job, but I was networking and saying, hey, if you ever think of me. And it worked out in my favor. I ended up in a job at Tenova, and I was at Tenova for over a year doing physician contracting, which I didn't really love. But when an opportunity became available at Covenant, I didn't really have to interview. I met one person. They were like, okay, here's a job, because I already met the team. I'd already interviewed with them, even though there wasn't really a job available. So you just don't know. I mean, that's the thing I would say, is you just don't know how the world is going to work out. And so certainly take the opportunities as they come. And even if it doesn't come to fruition, I mean, it was over a year when I'd been in market before I even had an opportunity at Covenant. And it was those connections I made a year ago that helped me get that job.
And if you think about it, Nancy, that advice is really good for any industry.
True. Very true.
Matt, how about you?
I mean, the biggest thing I would say, at least in my experience, because I almost messed up in this regard, is don't let the idea of where you want to go eliminate the possibility of what's in front of you, the opportunity that's in front of you. I mean, life kind of happens while you're trying to do something. And if you I try to pursue what I thought I was supposed to be doing or should be doing, and almost missed a great opportunity to do something else. I'd also say within healthcare, there's so much to learn in healthcare. I mean, and how it all ties together, just even in finance. I mean, everything, there's just so much. If you have an opportunity to learn a new aspect of it, take advantage of it, because the more you know how the entire ecosystem works together, the more effective you'll be at any given job you take or function that you're performing. So
Great, thank you. John, how about you? Any advice on Atrium or in healthcare?
In healthcare, see, that's the thing. So I certainly agree. Nancy might have given some great advice, right? Don't let the idea of where you see yourself being limit the individual steps that you need to take to get there. Pursue every opportunity that you can. Don't pursue every opportunity. Let the doors close on you, and don't let the doors closing take the wind out of you. Just channel it. But as far as healthcare goes, healthcare I mean, it's one of the biggest industries, if not the biggest industry in the country. I mean, 18% of our GDP is spent in healthcare. So, I mean, you can. A lot of people are going to find themselves in healthcare. I would say that you're talking to 3 people in healthcare, and none of us are healthcare providers, right? I don't know that Stacey, I'm having trouble answering the question as it's different in healthcare than it is in any other industry. Networking, you have to network. I say do informal informational interviews. I'm sure many people have heard about that. Reach out. Don't be afraid to ask somebody to go to lunch or coffee. Somebody who has the job that you think you want, find them, ask them to coffee, ask them to get on a Zoom session or whatever, and just do an informational interview. And then what, most of the time you can ask them that question. Do you know a role that's opening up? And they may know, right? And I would say I don't know. Is it, Stacey? Is it something specific to healthcare? I don't know. I don't think it's any different than any other. I mean, it's a good question. Network. It's very relational. A lot of people who are in healthcare are relational. So that networking is all the more important. I don't think a lot of people don't even care. They reach out third party logistics, and they may not want to give you the time of day. They may be wondering why you're reaching out, but healthcare, they're going to want to talk. They care. Most of them do. I'll stop.
And I think you're right. The advice, all 3 of you, it's all about flexibility, right? Don't be so focused on this one thing that you miss out on other opportunities. Maybe it's not your dream job, right? The first thing the first position that you have, and the importance of networking and reaching out and finding people, whether it's, UT Medical Center or PwC or Atrium, networking with people who work there, who have jobs you might be interested in, using the alumni network to reach out to people. That is a way to make inroads into most companies. And so I'm glad to hear that coming from you. All right, we have time for our participants. Are there questions that you would like to ask that we did not cover? If so, you are welcome to just ask them directly. You can type them into the chat. But anything that you think would be helpful for you to know before we end our session tonight? No questions.
I have one.
Okay, great, Blair.
You guys mentioned a couple different credentials that you did specifically related to operations. Are there any of those that you think were more worthwhile than the other that you use in your job? I think Matt specifically mentioned some.
So yeah, I'll for me, as you know, as I've progressed in my roles, actually the PM piece has probably been more useful for me on a regular basis than anything else. Just the principles and I don't maintain this certification anymore. I have the knowledge, but just the knowledge, to me, as you progress and you take on more managerial roles, it's just project management. And those principles apply, at least in my estimation, no matter what. And, it's allowed me to more efficiently work with my teams and coordinate them and their efforts and making sure everybody's, kind of rowing at the same time and going the same direction. So, I love the statistics of the Six Sigma, and I love lean methodology, but on a day-to-day basis, I probably use PM principles pretty much every single day. And it's kind of informed a lot of that for me.
Great, thank you. Any other questions? Okay.
I'll go back on Blair's question just for a minute. Is the thing I will say, like, so when I graduated from Wake, I had a black belt, the Lean Six Sigma black belt, whatever it's called. I don't think I used it a day in my career, but I think the things that I learned being able to take the program and get the certification and learn how to ask the questions are going to serve you in any job, regardless of where you are, whether you're in finance or in operations or wherever. I mean, project management, I don't know if you would say the same, but I look at all those certifications and I go, I may not be using them today, but the teaching me to think that way has been incredibly helpful in my long-term career.
I think, so for the undergrads here, if you're in a liberal arts program, you're going to learn to ask those questions, right? And I think that's a strength of anybody in Wake undergrad. You're at a liberal arts school, you have a wide, so you'll have a lot of varying classes that you take. And so learning to be inquisitive, learning to ask questions, those, like Nancy's saying, those are that inquisitive nature is going to carry you very far. Not being afraid to ask a question is going to carry you very far. And I do think there are some of those certifications that I think those who are in a master's program, your master's is going to speak for you. But I think for undergrads, a couple of those certifications would be helpful to differentiate you early on. So Nancy, it was great that you probably got your black belt, after undergrad, because it was something that many other undergrads didn't necessarily. Did you get it after undergrad or after MBA?
I got it with we started at an MBA and went green belt or whatever,
Yeah.
and then got black belt. But but I will say, I mean, in the same breath, I'm a politics undergrad. What is a politics undergrad doing sitting in a finance department? well, I can read the Federal Register pretty well though, you know, like there are so many regs in healthcare that like, and they're all driven. I mean, you think about not all of them, but a big portion of healthcare is government driven. Medicare sets a lot of the rules and a lot of the way this stuff works. And so understanding that and having that knowledge from my politics degree has certainly served me. I never thought it would this way, but you know, it's helpful too.
Those, so for undergrads, to answer the question, there are free Lean Six Sigma programs out there. There are free project management, sort of anything that you can put on your resume to differentiate you from those getting into the job world. That's a good, and there are plenty of them out there that are free. Something else shiny to put on your resume that the one in front of you or behind you might not have.
Great, that's good advice. All right, last call for any questions. Well, Matt, Nancy, John, thank you again for your time.